Find your vision. Unlock your potential. Connect and create. Visit iaminternationalmedia.org.
The United States is experiencing a major outbreak of Cyclospora. The outbreak highlights the importance of food safety monitoring and rapid cooperation between health authorities, food producers, restaurants, and consumers. Cyclospora, a microscopic parasite that causes an intestinal infection known as cyclosporiasis. If left untreated, the infection can cause explosive diarrhea for weeks. Health authorities are investigating a multi-state outbreak linked to iceberg lettuce sourced from central Mexico. According to the U.S. Centers for Disease Control and Prevention, CDC, the multi-state outbreak had reached 6,358 illnesses across 15 states: Arkansas, Illinois, Indiana, Kansas, Kentucky, Michigan, Missouri, Nebraska, New Hampshire, North Carolina, Ohio, Oklahoma, Pennsylvania, and West Virginia. At least 278 people had been hospitalized, and 2 deaths were reported in Michigan. Illnesses associated with this particular outbreak began on June 22 and continued through July 31. Separately, the CDC reported 10,468 laboratory-confirmed domestically acquired cases of cyclosporiasis since May 1, 2026, showing the wider scale of Cyclospora infections in the country this year. Investigators from the CDC, FDA, and state health departments found epidemiological and traceback evidence linking the outbreak to iceberg lettuce from Taylor Farms de Mexico, a processor based in central Mexico. On July 17, 2026, Taylor Farms recalled iceberg lettuce sourced from central Mexico because of possible Cyclospora contamination. The investigation initially focused on shredded iceberg lettuce served at Taco Bell restaurants in several states. As more patients were interviewed, officials expanded the investigation to include additional states and people who reported exposure to recalled lettuce. Symptoms include: Cyclospora infection primarily affects the digestive system. The most common symptom is watery diarrhea, which may last for an extended period or disappear and return. And also stomach cramps or abdominal pain, bloating and increased gas, loss of appetite, weight loss, nausea, fatigue, fever, or vomiting in some cases. Because some infected people may not seek medical attention or may not be tested, health officials believe the actual number of infections could be higher than the confirmed figures. The CDC and FDA are working with state and local health departments to identify additional cases and trace the contaminated lettuce supply chain. Officials have advised consumers not to eat recalled iceberg lettuce from Taylor Farms de Mexico and to throw it away or return it if they have it. The investigation is continuing, and the number of reported cases may increase because it can take up to 6 weeks for officials to determine whether a newly reported illness is connected to the outbreak. In order to prevent, people can reduce their risk of foodborne infections by following basic food safety practices. These include washing hands before preparing food, handling fresh produce carefully, using safe drinking water, and following official food recall notices. However, Dr. Jorge Rodriguez, a board-certified internal medicine specialist and viral researcher, said rinsing alone is not enough to eliminate the parasite. You have to cook it. Consumers should pay particular attention to recalled products and avoid eating food identified by health authorities as potentially contaminated. With thousands of illnesses already associated with the lettuce-linked outbreak, continued investigation and public awareness are essential to prevent further infections. Thank you for your patience with us on this matter. Till next time, I am Suthish Edmund Nicholas, signing off.